everybody, I am Thatnursingprof and welcome to my channel. In today's video, we're going to be discussing postpartum danger signs. So let's jump into it. The first of which would be a fever. So you have a temperature greater than 100.4 degrees Fahrenheit. Initially, that first 24 hours after delivery, mom's temperature will be slightly elevated. Okay, that's due to the stress on the body, the dehydration, the work of labor. That's okay, we expect that. But we don't expect it to be this high or higher. That's too high. So that would be a danger sign, a sign of infection. If mom reports frequency, urgency, or painful urination. So if mom's had a catheter, because maybe she had an epidural, or maybe mom had a C-section, right? And maybe they nicked her bladder or something like that. So these are things you need to watch out for. Not being able to urinate postpartum, whether it's a C-section or vaginal delivery, you should still be able to urinate within 8 to 12 hours after delivery. If you are unable to, that's a problem. Now, it is very normal to not feel like you have to go to the bathroom, okay? Postpartum women will say, oh, I don't have to go, I don't feel like I have to go. And then you'll sit them down on the toilet and then they'll just start peeing and they'll pee, 300 mLs. And they're like, oh, I had no idea. So they have that loss of sensation initially. That's just due to the hormones. That's fine. But getting them up, encouraging them to go to the bathroom, and they go to the bathroom, that's good. If you get them up and they still can't go to the bathroom, that's an issue. Of course, shortness of breath or chest pain, those are always emergent things. Those are always dangerous. Those can happen to the postpartum patient because of a PE, a pulmonary embolism, because we're in a hypercoagulable state postpartum, so we're likely to have clots. So they travel to our lungs. So shortness of breath. And then chest pain. You could also have a heart attack, right? That blood clot travels to your heart. Foul-smelling lochia. So lochia is that discharge. A lot of people just go, oh, it's the blood, right? It's not just blood, it's a couple other things, but yeah, it's mostly blood. It's the discharge that happens after a delivery, either vaginal or C-section. Both groups of people still have discharge, and it shouldn't smell. If it has a smell, it should smell like a normal period type smell, but it should never smell a foul smell. That's indicative of an infection like a choreo, and you definitely don't want to have that. Heavy lochia. So normal lochia should be like what mom gets for her normal period, except maybe a little bit more, right? That's a normal lochia. Heavy lochia is when you are completely saturating a pad in 1 hour for 2 hours in a row. That's a hemorrhage. So that's an emergency, you need to report that right away. Large clots, so clots bigger than an egg, too big, right? And clots should only appear on the first 3 days. So if it's day 4 or 5, it's been a week since delivery, and you're having clots, you need to report that to your provider. Swollen, red, painful area in the calf. So this is a DVT, okay? So these women, like we said before, hypercoagulable state, high risk for blood clots. Where do blood clots form a lot of times in pregnant women? In the lower extremities. So this is indicative of a DVT. This is something you need to watch out for. Returning to lochia rubra after it's already been serosa or alba. So lochia goes through color changes. In the first 3 days, it's rubra. That's that bright red color. We expect that. Then after that, it goes to serosa, which is more of like a darker brownish red color. And then after that, it changes to alba, which can be a yellow or a whitish color. So if you're already here, if it's, 10 days post-delivery and you're already at alba, that yellow or white, and then all of a sudden, you're bright red again, that's not good, okay? That's a danger sign. Swelling, redness, heat, discharge, or blood from an incisional site. So you had a C-section incision, you had an episiotomy, you had a laceration. None of these things are normal. None of these things should be happening at those incision sites. And also, I didn't put it on here, but approximation, I talked about this in my postpartum head to toe video. Approximation is when they sew the tissues together. So if you see an opening in those tissues, that's another danger. If mom has not been able to have a bowel movement 4 to 7 days after delivery, And that's kind of a wide range because everybody's bowels are different and some people don't have bowel movements as frequently. And it could be, related to, oh, I'm on pain medications and things like that. But typically, you should have a bowel movement within 4 to 7 days after delivering. If you don't, that's a big deal. You need to inform your doctor. Any kind of visual disturbance, so blurry vision, loss of peripheral vision, seeing spots, any of that, that's a big red flag. Need to report that right away. Severe headaches that won't go away. Now, it is normal to have some headaches postpartum because you're tired, right? You're taking care of a baby, you're not sleeping well, you're exhausted, you're dehydrated, right? Your body just did a whole lot of work. That's a normal headache. We expect those kinds of headaches. We don't expect severe headaches that don't go away. That could be related to your blood pressure, or it could be something called a spinal headache, where if you had an epidural or a spinal placed, a little bit of your cerebral spinal fluid has dropped out, and it only takes like the teeny tiniest little bit to create an imbalance, and this causes these severe headaches where you can't even lift your head off the pillow. It's really bad. So this is something we want to report right away. Flu-like symptoms. So flu-like symptoms can be associated with an infection, but also specifically I want to talk about mastitis. So if you have a red, hard, painful area in your breast, one breast or both breasts, and you start to have flu-like symptoms, that is likely mastitis. So you need to get that checked out right away. And then finally, the other danger sign I wanted to point out in this video is any signs of postpartum depression. Now I will do a whole nother separate video specifically on postpartum depression, but the big things I wanted to talk about here are crying for no reason, no ability to concentrate, you're exhausted, and then the big scary ones, thoughts of harming yourself or thoughts of harming the baby. That's the big stuff. If you have those kinds of thoughts, tell somebody right away. I know a lot of times women feel like ashamed to have those kinds of thoughts with postpartum depression because they're like, well, this isn't normal. People are going to think I'm a bad mom. No. It happens. It's okay. So please tell somebody right away if you have those thoughts of hurting yourself or hurting your baby so we can help you. And any of these other things, these are all reportable. Some of them will happen in the hospital while you, the nurse, are taking care of them, so you'll be able to get them right away. But some of these aren't going to show up until they go home, right? 2 weeks, 3 weeks out. So letting your patient know what to watch out for is really good and really important patient education that you need to provide so that they know when to call, so that they can get help when they need it. So that was my video on postpartum danger signs. I hope you found this helpful. Don't forget to like and subscribe. If you have any questions or comments, please let me know. And if not, I'll see you on the next one.